Here in the East tonight, we first told you about ECU Health closing several clinics last week. Those 5 locations are spread out all across the region, as you see here, from Williamston all the way down to Jacksonville. ECU Health says those closures are part of operational adjustments. The health system says they lost $46 million in the 2022 fiscal year. This is partly due to uninsured patients. To help those patients, ECU is continuing to advocate for funding programs like Medicaid expansion, something the General Assembly is looking into. Now, your side's Aaron Jenkins is digging deeper tonight to see how close we are to passing that expansion. So, Aaron, what are you learning?
Yeah, Kansas state lawmakers say Medicaid expansion isn't really a new topic. The General Assembly has been in discussion for years about it. I spoke with state lawmakers and officials today. They're breaking down what expansion means for you at home and how close they are to passing it. More than 600,000 North Carolinians could benefit from better health care coverage if Medicaid expansion is passed.
93% of people who would be impacted by this expansion, 63% are already working. We've got a little over 23% who are either caring for someone who's disabled or they have some type of infirmary themselves. 7% are students. You add it up, it's 93% good.
Health and Human Services Secretary Cody Kinsley says most of the money comes from the federal level.
They pay for 90% of the cost, and the state has to come up with 10% of the cost. We've worked out a way that our health insurance companies and our hospitals would cover that 10%. So there would be no additional cost to the state taxpayer.
The state would actually save money because of a signing bonus. Estimates would be that we gain about $1.3 billion.
It could also save money for insured North Carolinians.
Because we haven't expanded Medicaid, commercial insurance rates are about 8 to 12% higher. The average working class mom and dad who are going to work every day, they're paying more for their insurance because of this.
Officials say not only could the expansion save money, but importantly could also save lives.
We want to make sure that we save as many lives as we can. I think it's very much needed, especially in the rural areas, because there are a lot of places that do not have access, period.
Between 30 and 40% more likely for someone to be uninsured in a rural community than urban communities. Rural communities are bearing the brunt of this, and I believe the General Assembly can save rural health in North Carolina by moving forward with expansion. So I really do believe it's a matter of when and not if.
The lawmakers I spoke with say they're not sure when the expansion could be passed. They say the discussion is ongoing. The bill would have to pass both the House and the Senate before going to Governor Roy Cooper's desk to go into effect. In studio, Aaron Jenkins, 9 on your side.